Tuesday morning, October 1st, and the floodgates open for those seeking affordable health care insurance, including nearly 380,000 Utahns. Healthcare.gov went live on the web, providing a health insurance marketplace for all Americans, whether they are seeking more affordable health care coverage or presently don't have any. It's a means for all Americans to buy health insurance, which Utah House Speaker Becky Lockhart says is especially important for low-income families. She's just leery of what so-called Obamacare will cost taxpayers long-term.
Well, in the short term, hopefully not a lot. But if we decide to do the full expansion, they will be burdened with at least 100, 200 million more of their money will be going to fund Medicaid, which sounds like a lot of money, because it is a lot of money. And if you don't want a tax increase, then your other option is to cut other things in the state budget. So then we have to evaluate as a legislature, what are we going to reduce in order to shift that money over into Medicaid. So it's not an easy answer. These are people's lives we're dealing with, right? But these are also our taxpayers.
As a nurse, she worked in a hospital for 7 years and says she understands the way government programs work and the challenges they pose. But she'd rather see people move off federally subsidized programs and on to self-sufficiency.
We know that there are people out there who need help. We know that they're desperate in a lot of ways, and we want to help them. But we don't want to get caught in a situation where there's no way out.
Former U.S. Senator Bob Bennett worked for federal health care reform for a long time, but his efforts never resulted in a congressionally approved plan. Now, he says the Affordable Health Care Act will give Utahns some good things and some bad things. The good, he says, it will do away with restrictions on pre-existing conditions, allow your children to stay on your plan till they're a little older, and remove caps on catastrophic health problems. The bad?
Young people will probably see premiums go up quite dramatically. People with small employers may lose their insurance as the employer says, I'm sorry, I'm not going to offer it anymore. I'm turning you loose. You go to the exchange and work it out as best you can.
Both Senator Bennett and Speaker Lockhart spoke to members of the Utah League of Cities and Towns at their annual convention in September in Salt Lake City, discussing the effect this federal health care program will have on Utah.
But when you get to the issue of health care, particularly in this country at the moment, I think it is a time when you need to have both perspectives.
This upcoming legislative session will be key in determining Utah's involvement with the federal plan. The big question is whether to accept the initial subsidies, knowing that a few years from now the burden of funding the program will likely shift, falling on the backs of state taxpayers.
A lot of people say this is free money, or it's money that our taxpayers are paying, which in a lot of ways is true. But if we look at it in the context of $17 trillion of federal debt, printing money on a daily basis in the tens of millions of dollars, it's not real money, not really. And so we have to be really careful as we move forward in some of our decisions of if we're going to take that money, where we're going to spend it, all those kinds of things, and what that means in the future for the people of Utah and their tax burden at the state level.
Former Senator Bennett fully expects changes will need to be made.
It ended up a mess. And yes, I would vote to repeal it, but to replace it with something that wasn't a mess. And that would mean following the pattern of Franklin Roosevelt in Social Security, Lyndon Johnson in Medicare, George W. Bush in Medicare Part B, which is, here's the problem, let's focus on the problem, and let's get input from both parties.
For the Utah League of Cities and Towns, I'm Susan Wood.